Welcome, everybody. My name is Dr. Sarmen Sarkissian. So I'm a hematologist oncologist, and I'm on the board for the Armenian American Medical Society. I do chair the membership and mentorship committee, and it's a deep passion of mine to ensure that the next generation of students have the best access to healthcare providers that are in the field for guidance. And, as part of the mentorship program, I decided to start a small interview series where we're really interviewing our up and coming stars. And we really want to interview a lot of students along the entire spectrum, from undergraduates to those who just graduated, who are fresh into, say, for example, taking their standardized exams, whether it's the DAT, the PCAT, the MCAT, or those who have just matriculated and what it was like to go through the application process. And today I'm really fortunate enough to have a really rare find, somebody right in the middle of medical school. And so I want to pass the microphone on to the wonderful Sione Markarian. She's been a panelist for us. She's been amazing. So tell us a little bit about your background before we start to interview you.
Thank you so much. So yeah, my name is Sione. I'm a first-year medical student at UCLA, actually kind of wrapping up my first year these next few weeks. I did my undergrad at UC Berkeley, and then I had a one-year gap year. And honestly, AAMS has been such a big part of my journey and helping me find mentors and advice. So I'm really excited to be able to give back just a little bit of that to anyone that's watching.
Very good. Thank you. So, I'm glad you brought up Berkeley because that was the first question I wanted to ask you. So, obviously, Berkeley is a very challenging school. You were living away from home. I'm sure you were enjoying your major, but professional school is really going into high gear, and it's kind of hard to have any similarity or any parallel in undergrad. What was the biggest difference you noticed, and what was that transition like from undergrad to professional school?
Yeah, so this might be a little controversial. I think professional school, grad school, med school is so much better than undergrad. It's very different. Actually some people that say it's a little bit easier than undergrad, and I agree and disagree with that at the same time. I definitely study a lot more now, but I think because it's information that I enjoy learning, it isn't as draining. Like personally, I didn't like history, English, all those required classes we had to take. So now I'm just learning what I am actually passionate about. And you have a lot more free time in med school, at least, and I'm sure it's the same for other professional programs too. It's a lot of more time on your own. So right now, we don't have any homework assignments due every single week to kind of keep us on track for keeping up with this chapter or this topic. And we don't have finals and midterms every few weeks to kind of keep us on track. So it's really just, at least in our case, one exam per block. And it's kind of on you to make sure you're keeping up with everything, whether you want to enjoy like 4 weeks of the 8 week block, like kind of relaxing, and then cram it all in 4 weeks, or space it out and kind of have a balance. Um, I think that's the biggest difference between undergrad and grad school. It's also a little bit faster. So what you would cover in undergrad, maybe like in immunology in an entire semester, you might be covering it in our case in like 4 or 5 lectures. So it's a lot more fast paced and it's still dense information, but again, like it's very much in your control for how you want to approach it. The environment is also really, really different. So I at Berkeley, pre-med was a little too competitive for my liking. Like you didn't really collaborate with your peers. It was graded. There were curves. Everyone wanted to do better than the other people so they could ask their professors for letters. But here at most schools, actually, it's pass, no pass for the preclinical years at least. And I think that's the biggest difference. Don't get me wrong, it's also, you still have to study to pass, but you're surrounded by like-minded people all the time. You collaborate a lot more than in undergrad. It was kind of an adjustment for me because I thought I would just show up, study, go to class, come home, study on my own. But you really build this professional community with people. And I think the people you meet are also really passionate about the same thing. So it's, in my opinion, it's a lot better in some senses, but obviously a little bit tougher in other ways.
Yeah, wow, you bring up a lot of really important points. So it seems like you really enjoy the fact that, the classes you're taking are directly applicable and it's what you've been wanting to do all these years versus, just dealing with what sounds like another prerequisite. Is that correct?
Yeah, for sure. I think that's the best part.
And you really enjoy that collegial atmosphere. It doesn't feel like, no one's sort of hoarding notes or telling you the wrong office hours, for the professor. And you said it was 4 p.m., but it was actually 2 p.m. Oh, whoops.
Yeah. It's so different. I don't know if that was just my undergrad experience, but we have a group chat with the 180 people in our class, and I don't think
Wow.
there's a single note or Anki flashcard deck or resource that someone makes and doesn't send, because I feel like at this stage, like if everyone passes, everyone passes. It's not like only 20% of the class can pass. We don't have honors, we don't have rankings. And that's kind of consistent for most med schools. Some med schools still rank, but I feel like it's really gearing us towards what it's going to feel like when we're actually in the workforce. Like, no doctor does everything on their own. You do collaborate across different specialties with nurses, radiologists, all those people. So I feel like they really push us to start doing that now as well, which is really, really nice.
Oh, absolutely. It'd be very unusual for somebody in my line of work to be competing. It'd be very awkward and you'll be shunned pretty quickly because no healthcare provider knows everything, and it's pretty rare that one person is sort of the end all be all decision maker and doer. For me to provide proper cancer care, for example, I'm dealing with at least anywhere from 3 to 5 different subspecialist physicians. If you throw in every other person, whether it's technologists, nursing, even people taking care of billing and authorization to make sure whatever you need is ready to go on Monday morning, you're probably talking about a team of 40 to 50 people in the background working for, a single patient. So very good. I mean, let's backtrack a little bit to your Berkeley days. How did you get yourself ready? I mean, there's a lot going on. You have to have, exceptional grades. Berkeley's a very challenging environment. You obviously have to prep for your MCAT, take it, do well, get your letter of recs, on top of that, polish it up with your extracurriculars. What are some of the key points from that hurricane you survived?
I think the biggest thing is kind of just planning ahead. And of course, if you know you want to go into medicine early on when you're in pre-med as an undergrad, you can start planning ahead, or at any stage where you kind of decide like, oh, I want to go to med school. I feel like the best thing I did was come up with like an Excel sheet plan. Like, these are the classes I need to take. These are the letters that I need for med school in the future, even if it's like 3 years down the line. This is the MCAT. These are the classes from Berkeley that are going to be on the MCAT. Let me make sure I take like better notes for these specific classes, do a little bit of extra work. So I feel like planning was kind of like the key to success for me. And I still took a gap year, but I think planning ahead and knowing I'm going to take the MCAT at this time, and applications take a whole year. So let me plan ahead to make sure that I'm not thinking, oh, if I apply in June, then I'll start in September, and then have like realized late that like it actually takes an entire year. And then like you had mentioned, like office hours and stuff like that, like getting to know your professors can be really hard when you're at a big institution like any of the UCs. I think it's a little easier at smaller public schools with like maybe 100, 200 people in classes, but like my computer science class or bio class had upwards of 1,400 people. So like the professor had no idea who I was. And that meant like, okay, be realistic. You're probably not going to ask this professor for a letter. Like, there's 1,400 people. So I think planning ahead allowed me, like in these smaller classes, like some of my anatomy class, for example, to get close with my professor. We were 40 people in the lab, and just I knew from the start, like, this is someone I'm going to ask for a letter from. And that kind of ties into something I did that helped prep for med school. Anatomy physiology is probably the only like I absolutely recommend you take this course type of course that there is. If anyone has the opportunity to do like an anatomy cadaver lab, I did it my junior year at Berkeley. And the only reason I say this is obviously when you start med school, you're not gonna do amazing in anatomy just because you took it, but anatomy is its own language. Like not only did we learn where the muscle or ligament or nerve is, but the name in itself is a whole other language. Like, I don't know, iliococcygeus, like that itself, like learning how to spell that or what that word even is, like that took its own thing. So I think the initial exposure that I had in undergrad to anatomy, to seeing a cadaver, which honestly can be an emotional experience. And I think all of that prepped me pretty well. And we definitely go into much detail now, but that like baseline knowledge really helped. And that goes for most of the pre-med classes. Like you take the MCAT, you study all of that, and then you kind of just want to throw it all away. But it comes back, like it comes back and they don't teach you it. They just expect you to know it and all the different things that you're learning. So I think definitely those undergrad classes helped, but I do think the most important thing that helped me prep for med school was having some sort of clinical or volunteering experience. And you don't have to work years as an MA or work as anything, honestly, just having a small experience where you've already spoken to a patient before, you know how to talk to doctors, you know how to talk to the medical team, really helps with the initial nerves. And honestly, I think it's important because it kind of gives you like an anchor or like a reason when you're really stressed in med school. Like there's no better feeling than actually learning the things you saw when you were volunteering or putting puzzle pieces together about a patient maybe you had an interaction with a few months ago and realizing like, oh, this is why that doctor made this diagnosis. And it kind of like anchors you back when you're stressed for like, that is the experiences that you're looking forward to. And I think definitely helps as far as like the nerves aspect as well.
Yeah, I have a lot of students that rotate through my clinic as shadows. And what I make them do is go interview the patient and come back and give me a short synopsis. And, by the 10th time they do it that day, they get better at it. And I tell them, well, this is kind of it, race car drivers know three things: steering wheel, gas, brake. Physicians know, three things: examine the patient, talk to the patient, and then come up with a plan. So it's very good. And you do bring up a good point because, a lot of us in undergraduate were just sort of immersed in basic science and extracurriculars, and there is no there's no parallel or equivalent to professional school and undergrad. You don't know what it's like to examine patients as either a dentist or a physician in any undergraduate class you take. Nothing even close. So I think shadowing is a really important opportunity. So, you mentioned about 80,000 things you were doing, and there's only 168 hours a week. How did you sort of not lose your mind? How did you know, manage your stress levels? What were some of your blow off valves? Because you need these mechanisms to
Mhm.
get through professional school too.
Honestly, I think some people will use like working out as a stress like relief type of thing or an outlet, but I think the most important thing is you really do need a village to get through even undergrad or any kind of professional school. I thought I had work-life balance figured out in undergrad. Medical school was very different. It was really intense. My friends and family became like obviously my biggest support system. I'm really lucky to be very close to home, like still in LA, but that does mean that like I have to set certain boundaries and stuff like that, which took me a little bit of time to kind of get used to. Like as far as every single week or every few weeks, like stress relief will literally be driving to Glendale, having some Armenian food, hugging my parents, like being close to home. I can call up like my college and high school friends and say, I need to study like for 12 hours today, but can you come study? Or if you're watching a movie, can you come watch a movie next to me? Like just so I have like a person with me. But I think like those are my outlets, like calling a friend, calling family, and just kind of disconnecting and venting for a moment is what I do, and leaning on them is the only way I can get through it. I always tell like anyone that's starting, like you can't do it on your own. Yes, you're very smart. Yes, you've gotten here like yourself, but there's no issue in leaning on like a community that you build. Um, and then like mentors, like you guys, honestly, or other medical students, like having someone to get advice from, even if you call them and say, I'm going to fail this like nephrology exam, I hate the kidneys, all of that stuff, like they tell you do X, Y, and Z and you'll be fine. And just hearing someone say that, I feel like that's how I tend to manage my stress. I think also having a routine and having some non-negotiables is also really important in med school. Like your time is, sometimes it feels like your time is not yours and you're just going from class to lab to patient interactions and then coming home and having to study for an exam. But I feel like if you have something that's important to you, whether it's like working out, hiking, running, music, art, like anything like that, you need to kind of figure out what your hobby is before you start, what you enjoy doing, and use that as an outlet, because it can get a little overwhelming if you don't have a way to kind of disconnect from everything that's going on around you.
Yeah, you know, mentorship is really important. I remember, you know, I didn't have anybody in my families out that was in healthcare, and it's just something I chose to do. So, but I remember there was a Dr. George Kazanjian. You know, he was kind of a distant cousin, but more importantly, he was like a family friend, and now he's on faculty at UCLA. And you know, he looked at my personal statement. He gave me a lot of really valuable advice, and because he could tell me like, you know, I agree or disagree with what you wrote here. I mean, it made a tremendous difference. There was Dr. Andrew Vartanian, you know, he's you know, burn surgeon and plastic surgeon now, and he looked at a couple of my interview strategies, and you know, he said, no, I don't think you should say this at an interview, or I think you can amp this up. And you know, these were priceless pearls of wisdom, you know. Um, there was a, you know, Lebanese MD PhD student, well, postgraduate student in the lab I was working in, and he gave me one piece of advice for my personal statement, and I asked him, "Are you sure you want me to put this paragraph in here?" I'm like, "No one else would tell me this." He's like, "No, trust me, put it in there." And you know, I think it made a big difference because it definitely started coming up on the interview. So I think mentorship, those small course corrections, which only somebody in the field can tell you, you know, it's not going to be available on studentdoctor.net, you know, or on a Reddit post or something, priceless. But, you know, but it takes engagement like you to be involved in a society and get to know people. And, you know, we're always here to help. So looking at, you know, this, you know, you manage your stress, you get into professional school. What does it actually look like? You know, because undergrad is mostly a series of lectures, you know, maybe an OChem lab, which is fun. But you know, unless you're going to become an organic chemist, like you just can't devote the number of hours to get very good at lab. But what's interesting about, you know, professional school is, okay, you go to the lectures and then you start seeing patients right away in these rotations, and you're like, oh wow, like I'm, you know, starting to see patients. And by the end of 2 weeks, you're like, wow, I've seen 100 patients, you know, you got good at it. What was that like for you?
Yeah, so definitely an adjustment of how quickly you learn something and then are expected to apply it. We haven't started rotations yet. We're starting in October, but like even in lecture, we'll watch a lecture that's pre-recorded and then we'll go to a lab the next day with like standardized patients, which I'll explain a bit about, and you're like immediately applying it. And I think it's definitely nerve-wracking and it's a little bit scary having to, you can't fall behind and you kind of need to be on top of your stuff. But once you apply it, I feel like it's locked in once you associate it with a patient. But every school's kind of different. So generally, the first 2 years of med school are in a classroom. You're kind of just learning. And then third year, you start rotations, continue that into the fourth year. You do your sub internships, finish up some rotations, and you're done. Our school is a little bit different. Our first 2 years are condensed into 1 year, and then we start rotation second year, get a research year for our third year, and then continue fourth year like everyone else. So I think knowing your school's program is so important. I thought it wasn't going to be a big deal. I was like, oh, like 2 years versus 12 months, I should be fine. It's very different at every single school. So definitely depending on the type of learner you are, I think it's important to know what you're getting yourself into. I love that we get clinical experience really early on, and is a little bit more independent as far as what we're learning. So essentially our weekly schedule is kind of consistent. We get online asynchronous lectures. So most of our content is just pre-recorded from our professors. We can watch it on our own time. really thankful for that because like putting it on double speed is so nice sometimes. And then we basically have large group sessions every week, usually 2 to 3 times a week, where we all go to the classroom and we're sitting at these big tables and we're just going through questions and patient cases and stuff like that to kind of apply what we've learned. And then we have like doctoring courses twice a week for 4 hours each. And that's when they bring in these standardized patient actors and we get to practice physical exams, history taking, delivering bad news, all of that stuff. And then a lot of ultrasound workshops at our school, which is cool because it's one thing to learn about these organ systems in a textbook, and then it's one thing to see it on a cadaver, but then it's another thing to see it like live and moving on an ultrasound, which is honestly one of my favorite things that we do. And then like once a month, we take everything that we've learned and we have something called an early authentic clinical experience. So you get assigned a site from maybe even, I think, week 2 of when you start med school. And once a month, you go to this site, you're rotating with the physician, you're seeing patients, you're interviewing them, doing physical exams. And it's a little bit scary because you'll do a physical exam and the doctor will be like, okay, like if everything was normal, and you're like, do you want to check? Like, are you sure you want to double check for me? And they're like, well, at this stage, like towards the end, they were like, we think you know what's going on. Obviously, if it was something big, they would have noticed it too. But again, like things like that, like getting clinical experience in med school and applying everything you're learning from hours of staring at a lecture on your computer, ties you back to like why you wanted to do it in the first place. And there are times where I'm like, oh, I wish I could use this 4 hours to just sit there and study for the exam. But then I go to the hospital and I'm like, okay, now I have a second win to kind of remind me of why I wanted to do this. And then I come back and I study. So a lot of clinical experience, a lot of patient experience. And I think it's the most fun, the most stressful, but the most rewarding part of all of our year so far.
Wow, that is a lot you've done just in the last 1 year and 8 days, right? Because you started last July 1st, so that's quite a bit. I mean, you're doing lecture, you're doing practical workshops, you have a continuity clinic, and then you have the actors, the patient actor. That's definitely quite a bit. But it is interesting how your format is not standard across the country. So I think this is a key piece of advice when people are ready to interview at medical schools. Make sure you do your homework for that medical school so they know that, one, you don't treat them like they're just some other medical school you were lucky enough to get an interview at and you think you have the right to interview there. Second, they take pride in their curriculum, but because there's so many people involved in organizing a curriculum, and you want to show them that, you've done the research and you've thought about how UCLA's curriculum is different than UCSF, different than Loma Linda. It shows that you appreciate that, and perhaps you'll realize that school is a fit for you, and maybe it's not a fit for you, because there's no school is going to be a fit for every student.
Yeah.
They're just not. So coming back to a couple of other things, so do you enjoy the fact that you're learning something that's completely applicable? I know you mentioned earlier that, you're not going to love every single class you take. One, I'm sure you're enjoying every class you're taking in medical school, but what have you really enjoyed so far?
I love, like I said, I love the fact that everything we're learning you can apply. And not only like in school, like my friends will text me or my family will text me and say, oh, this is a symptom I'm having. And I'm like, okay, look, I'm 8 months in, like I can't help you, but you can help them like navigate what they're experiencing, tell them to calm down or tell them to go get it checked out and all of that stuff. So even that part of it is really rewarding. It's really different from any schooling in the past where you think like, okay, let me learn this equation for this calculus exam and then take it and then I can just forget about it because it's not going to apply. You're actually you're actually learning something that you're going to use and it feels important and it feels like one day you're going to help someone. So that in itself like motivates you to actually want to learn it. And I feel like it's there's no class that I don't like. Again, maybe there's certain specialties or certain organ systems where I'm like, yeah, that's not for me. It's a little too much. But honestly, my favorites so far have been cardiology, which was really cool. And it's there are things that you parallel to like undergrad classes like physics and stuff like that, where you're like, oh, if they had taught me like this, maybe physics would have made a little bit more sense to my biology brain. But yeah, overall, I feel like it's a whole other world of information that you're learning, and it's actually really enjoyable, as tiring as it is.
Very good. So we have a budding cardiologist. So
Maybe.
there's a, with the diabetes and the obesity pandemic in the US, that, maybe we're going to need more cardiologists, that's for sure. So it's good. I'm very happy about the fact that, you at least enjoy a lot of your classes and there's some that you're already loving. I know you mentioned cardiology from, the lecture series that you enjoy. Do you have any ideas as to whether or not you think you'll want to specialize, or would you rather be a generalist, whether that's in a surgical field or a medical field?
I think I definitely do want to specialize. My brain kind of works in a way where I like knowing something in a lot of detail rather than like a majority of things in surface level, like a more surface level. And I do have a few ideas of what I'm interested in. Like I mentioned, like cardiology was cool to learn about. I haven't seen it in action, so I feel like when I go on rotations, that'll make a little bit more sense. Plastic surgery and ENT or head and neck surgery are kind of the two things that I've kind of gotten more involved in this past year with research and shadowing and clinical experiences. But I've been told by everyone, just enter rotations with an open mind because you never know. Like I mentioned, like clinical experience is really important. If you asked me a few years ago, I would not answer surgery at all. But during my gap year, I worked for a vascular surgeon, Dr. Samurjan, and that clinical experience actually changed like everything. I fell in love with the OR, the procedural part, the patients, the detail that goes into it, the immediate change that you can make. So right now I'm kind of headed down that path, but we'll see once I do my 8-week surgery rotation if that changes.
Yeah, you bring up a good point. As I had mentioned to you earlier, I had gone in thinking that I would like surgery because, can't explain why I thought I would like it, partly because I didn't really have other interests going into it. But then, I realized I didn't really love anatomy. I really didn't enjoy being in the OR. There was a lot of downtime. And, I felt like, just the OR schedule and your schedule was so dependent on other forces
Mm.
that I just felt like the entire package just wasn't for me. And then coincidentally, I had my medicine rotation after, and I felt like, oh my God, everything I learned in the lecture series that, you know, some people may have thought was a chore and I just kind of enjoyed learning. I already started applying it right away. Oh, why does this patient's creatinine elevated? Why are they feeling short of breath? And I'm like, oh wow, this just dovetailed really nicely. And then in my fourth year, for some reason, I thought I'd convinced myself that I'd want to be an anesthesiologist. I don't know why. You'll realize you don't have the most, you think you're a mature person, but even along the way, you're still learning maturity, even as a quasi-mature person. And I almost talked myself into even clicking submit on the application. And finally, I'm like, Sarmen, what are you doing? Just go back to you liked internal medicine. Don't talk yourself out of it for some, quackamania variables. And, I've been very happy since. So sort of coming back to you, because, I want you to be able to, reflect on everything you've done. What do you think is the best and worst part about medical school so far? And what do you think are some of the hardest and easiest parts?
Yeah, I'll start with the hardest and worst part so I could end on a higher note. But I think honestly, the hardest part of med school, grad school, honestly, any kind of schooling that you're in is that life outside doesn't stop just because you're in med school. Time doesn't stop. Like it would be really, really nice. But while you're studying, the world outside is still happening around you. You're going to have life events, family events, losses, and you're going to have to navigate all of that while you're studying for a huge exam. So I think that's definitely the toughest part. And I mentioned like setting boundaries with friends and family, especially when you're really close to home. Like in my case is honestly was a little tough in the beginning. Thankfully, I have very understanding parents. My brother's very understanding, my friends. So when I say like I have to study, it's not that I don't want to drive in LA traffic to go to Glendale. It's more so that like I don't have a choice. But I think setting your priorities, setting boundaries, especially closer to exams is tough. And then like once you're done, you have like a good week or 2 weeks to kind of make up for everything, go have fun, hang out with family. So I think that's definitely one of the toughest things. Another big thing is just, I'm sure everybody has heard like med school is like drinking water from a fire hose or fire hydrant. And I thought people were just saying that. And I was like, oh, how bad can it be? There's only so many things that can go wrong with the body. There are so many things that can go wrong with the body.
Yeah.
And and it's just the sheer amount of information you have to learn in such a short amount of time, I think is the hardest part. And I don't necessarily think the information itself is too complex or too difficult to understand. It's just you have such a short amount of time to memorize it all and understand it all, and not just for the short term, like more so the long term. Um, and also like it can be emotional at sometimes, which I didn't necessarily think would be an issue, but you read about diseases, you read about patient cases, symptoms, like prognosis for conditions, and sometimes they're conditions that your family members might have or your loved ones have, and it's really hard to learn about it and see like point blank the facts for like, oh, this is what they're experiencing. And sometimes our patient interviews are about topics that you've seen a doctor give a talk to your parents about. And I think there's a good side to that because then you know how you want to frame it as a doctor in the future, but it's also a little tough and emotional and emotionally draining when you're doing it, whether it's a real patient or even a patient actor. So yeah, I think that gets easier with time, and I don't think the compassion and the emotions are necessarily something to get over or hopefully not have when you're a doctor. Like, I think that's a good thing to hold on to, but yeah, that's definitely something I didn't expect. Um,
You know,
and
when I remember I did a mentorship event once, and first thing I told them was at UC Irvine. It was for the ASA there, and I told them, well, imagine it's like a summer camp, but it's 4 years of a summer camp. 24/7, 365, you are in that summer camp. Yeah, you go home to your like friends and family for the weekend, but you just get sucked right back in. So, and what
yeah,
else did they say? Sleep, study, party. Pick two out of the three.
yeah, exactly.
So, well, anyway, you wanted to end on a high note. What are some of the things that those are some of the chore-like features, but like, what else do you love about being there?
Honestly, I think the best part of med school for me is the people that I've met. A lot of people told me like the people you meet in med school are going to be your closest friends forever. And I was like, yeah, I mean, I was in undergrad. I didn't make that close friends with the people in my bio classes, but the group of friends that I met literally walking from our med student like housing to campus on the first day have become my second family here. I see them more than my own family and friends. You spend like hours and hours studying together in like a little room with a whiteboard and a desk, and you're laughing, you're crying, like sometimes even sitting in silence. And then you look up and you see how tired your friend is, and you're just dying of laughter. Like, even now, thinking back 2 weeks ago, we had our finals for our last block. And I don't know why we thought we could tackle anatomy, like 8 weeks of anatomy in one night. And at some point, it was like 4 a.m. And look, like remembering back to it, I just remember us laughing so hard trying to come up with a way to remember a name of a bone in the pelvis rather than how stressed I was. So I feel like the people that I met, like I would not make it through med school without them. And that's also really different from undergrad too, because you're just surrounded by people who share the same interests as you, but they also like work hard and play hard, and everyone travels together over the weekends after exams. Like, you go out with your friends, and it's just honestly such a fun experience that I didn't expect to have in med school.
Yeah, we used to call it trading war stories, because everyone's going to struggle with something. Maybe it's a class or a lecture in general, or their rotations. For me, the rotations were significantly easier than the lecture series. For some of my other friends, lectures were a breeze, but maybe
Mhm.
they hated waking up at 4 a.m., or they didn't like the fact that there's a subjective evaluation, or they really had no interest in neurology, and they're, you know, kick, shout, and scream about why they have to take neurology for 4 weeks. So somewhere along the way, everyone kind of struggles. And I would say that's one of the uniting forces, that no one walks out of it like getting an A+ in everything.
Yeah.
Maybe there's like that one kid and you're like, oh, whatever. Maybe they'll hate residency or fellowship or something. So, but then again, I mean, you're bringing back a lot of memories about just what that experience was like, and you could probably write an entire book just on your first year, I'm sure. So,
Yeah.
or maybe your own YouTube channel, who knows? So very good. And just to close off, I just want to say that, we're just for us that have been, practicing and, on the board for the society, we're just so happy that, the next generation of Armenian youth like you're already in professional school, you're just smart, have a great personality, and we know you're going to come back and serve the community and, help mentor some of the younger kids coming out there. So again, we're just very happy that, you're able to even volunteer your time as busy as you are for this interview.
Yeah, I mean, we have
And
really good role models to look up to, so we just follow in all of your footsteps.
yeah, no, we're really appreciative. And any last closing remarks before we end the interview?
No, I think that's all. I mean, if you're on the fence about going to any pre-health, like dental school, med school, whatever, I feel like these podcasts or these interviews are such a good way to kind of tease out whether it's something that you'd be interested in. So, yeah, I hope we get more of our, I guess, new generation like joining us here.
Yeah, very good. Thank you again, Sione. Soon to be Dr. Markarian in about 3+ years, and we'll look forward to the next interview.
Thank you.